Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me once again is Dr. Rashid Chotani, an infectious disease expert and medical officer at IEM. Thank you so much, Doctor, for joining us once again.
Well, thank you, Heather, for having me on the show to talk about a very important subject that is affecting the world and affecting the United States in a big way.
Yeah, it certainly is. Let's talk about the big news today, and that is that the South African variant of COVID-19 has now been found here in the United States.
Oh, yes. Amazing news. Unfortunately, that is something that we have to deal with. Now, it is normal for a virus to mutate. That's the most important thing that we need to understand. Now, COVID-19 has the corona SARS virus 2 has circumvented the globe. And, in different areas, different locations, it has mutated. In UK, we saw a mutation, which is now being seen in a big way in the United States. Then there's the South African variant, which is probably in the United States at this particular point, and probably will spread. So we have to deal with all of these things. And on top of that, we've got a Brazilian mutant variation of the virus now. So we'll have to deal with it as we go by. Now, the South African variant that we have identified is not the vaccine and the monoclonal antibody might have a difficult time, providing protection to individuals. So that is the critical problem. The UK strain, because of the buffer factor that we talked about last week, is going to be okay. But we've got some issues to deal with over here.
Yeah, the main concern, Doctor, seems to be when it comes to vaccines and if they'll still be as effective on this new variant. Your thoughts on that?
So the UK variant is going to be okay. The vaccine can deal with it because of the buffer factor that we've got. As far as the South African strain, we believe that there might be some issues and studies are being done. And at this particular point, the two vaccine manufacturers have already started testing it in the lab and are prepared to modify their vaccine so that if that becomes the big strain and we confidently can say that this vaccine is not effective against it, that we can modify the vaccination strategy. That would mean that perhaps we would have to give all the individuals a booster dose, but not the two vaccines. But still, we are learning about it. And as we move forward, these are the authorities, the White House, CDC, FDA, and the vaccine manufacturers are looking at it very carefully. All the scientists are extremely, vigilant about making sure that we have countermeasures when this effectively happens in the United States. And it is going to happen. It is not when, but as soon as we see a lot of these cases, we'll have to come up with some kind of intervention. However, the vaccine, the two vaccines that are being administered right now, I would urge everybody to get those vaccines because irrespective of the efficacy against the new strain, it will provide you with protection against the wild strain, the first one that we found in the United States that's circulating right now. Irrespective of whether we get the UK strain, irrespective of the South African strain or Brazilian strain or any other strain that comes out, we will still have the wild strain circulating in the community.
Okay, so the message is still get vaccinated. I want to move on to something else that has a lot of people talking, Doctor, and that is about the masks that we wear. Is one mask enough now, or should we all be wearing at least two of them at once?
So in recent weeks, European countries have begun mandating medical grade masks in public setting as the virus strain first identified in the UK, has ravished the communities, this new strain that's more infectious. British scientists have estimated it could, the surgical mask could decrease the transmission by 70%. Now, as we all know, that surgical mask and N95 mask, by the way, they're very uncomfortable for the general population to wear, are difficult to obtain, and they are reserved for the healthcare workers. So should we have two masks? Initially, some of the physicians, the top scientists in the country were advocating for it. And even Dr. Fauci had said that two masks are better than one mask, or a two-layer mask is much better, which is a washable mask, much better than anything else. But then, there's been some walking back in terms of all of that discussion because the mandate needs to come out from the White House or the CDC. And we are still waiting for the guidelines from those two organizations to give us good advice as to what needs to be done.
Yeah, and there seems to be not only a little bit of confusion here about one mask versus two, but also concerns that if you do have two, perhaps you'll mess with both of them a little bit more, touch your face more. Could that, in fact, then pose some problems?
So, yes, it could cause some problems, but in all honesty, I mean, if you look around, a lot of people are wearing double masks, two masks. And I mean, it's just a habit that needs to be, if I believe that double masking or the double layered cotton mask is the best choice right now. But we'll have to see what what the CDC and the White House have to come, when they come out with those guidelines. But as we got used to wearing one mask, right? If we wear two masks, we'll have to come up with ways that we are protecting ourselves and our fellow citizens, in terms of getting the disease or transmitting the disease. So it's going to be a habit-related thing. But surgical masks are definitely better. If people can wear those, I believe that's much better than a cotton mask or just a homemade mask. If the fleece mask is not something that I recommend, and I really don't like those because they stretch. When you put it on your face, it stretches, and when it stretches and it's got one layer in it, the pores or the pores between the fabric just, because it's elastic, so it extends, thus creating a much larger space for the virus to enter and exit from your person as you're breathing or as you're talking, etc., or coughing. So we have to wait a little bit, but if possible, one of the things, you have to wear a mask, period. That's something critical. If you have a surgical mask, that is much better. If you don't have a surgical mask, if you have a cotton mask, what you got to do is you got to have two layers on it. If you need, and if you're not too uncomfortable and you are taking care of the mask, then wear two masks. Again, if it's a cotton mask and you're wearing two masks, you got to wash them. If it's a surgical mask, at the end of the day or when you think it's soiled, you got to throw it away and replace it with another mask. N95s, yes, they're the best, of course, but they're very, very difficult to keep on your face, 8 or 12 hours a day. So bottom line message, wear a mask irrespective of what when the policy comes out, we'll talk about that. But at this particular point, wear some sort of a mask. If possible, wear a double mask because of these new variations that we are seeing, which will come to United States, whether it's Brazilian, whether it's South African, and we know that almost 50% of some of the cases that we are seeing right now in certain jurisdictions in the United States are the UK strain.
Okay. Now, Doctor, finally, the last thing that I'd like to talk about today is that new study from the CDC looking at any potential risks for kids going back to the physical classroom. And they looked at some of the data from schools that reopened earlier in the year. Let's talk a little bit about what they found.
So they found that risk and the transmissibility risk are very, very low in these settings compared to other congregate settings. And, obviously that is what we want. Yes, there is always going to be a risk, but we've got to open our, business, economy, schools, etc. And we'll have to take some risks, but we'll have to take those risks with certain measures that we implement. And if the measures are implemented appropriately, then we decrease the risk of any kind. Again, if we have testing, if we have all the strict preventive measures in terms of masking, in terms of some sort of shielding, some sort of distancing, then we definitely should be able to open the school. Using a hybrid model perhaps is one of the best things that we can look at, so that some students go to class X number of days and the other students go to class X number of days, and then the rest of them, during those intervals, take those classes from home so that we can, maintain social distancing. Again, the critical thing is to prevent crowding in those classrooms, increasing air ventilation, and expanded screening for testing, rapid testing of, individuals, and having a system where you're looking at, symptoms and identifying those, as well as identifying asymptomatic individuals or kids with rapid testing.
Yeah, and that is in fact what the schools that were part of this this study did. They took a lot of precautions in place, limiting the number of kids in a classroom, making sure that they weren't engaging with students from other classrooms, really kind of keeping that engagement small. So bottom line from that study, what does it tell you about eventually reopening classrooms for in-person learning?
So again, one of the things that I've always said is that unfortunately we are not in control. The virus is in control, and there are so many different things that we've got to take a look at. Now we've got this mutant strain. I'm not, I'm concerned about the students. Obviously, I've got children, and I want to make sure that all our kids are safe, and we provide them more safety, essentially, as parents, than we provide ourselves sometimes. So that is very critical. But, I'm also concerned about the teachers, right, in the school, because most of them, if not all of them, perhaps not even most of them, but at certain percent of them fall in the high risk category. They might have the age, in terms of the risk factor, or they might have some of the comorbidities. So those are the individuals that we are concerned about more. And I think this entire strategy was not just for students in the classroom, but also taking into effect all the staff, the teacher, everybody that works in a school system to make sure they're safe also. So I'm awaiting CDC guidelines in terms of what is it that, how they're going to look at it, because they will have to look at it from a comprehensive way. Yes, the transmissibility among the students was not high. So we know that that is something that we can do with protective measures. But I still have to be very cautious in terms of looking at what is happening with the staff and the teachers of the classroom, and in the classroom, or the staff across the school, and how we're going to protect them in a much better and effective way.
All right, Dr. Chotani, really appreciated a lot of developments over the course of this last week regarding the coronavirus, and really appreciate you coming on to break it all down for us. Dr. Rashid Chotani of IEM, thank you very much.
My pleasure. Masking, social distancing, and hand washing. Three of the most critical things that we can do. If you can get the vaccine, get the vaccine. If you are eligible to get monoclonal antibodies and your symptoms have developed 10 days ago, around 10 days, and you're positive, go get the monoclonal antibody. It is available in most states, and the federal government is providing it. So essentially, you can, if you have a monoclonal antibody infusion center, go there in 2 hours. You can get treated and go back home. Very little side effects of either the vaccine or the monoclonal antibody. So these are effective treatment and protection that you can get right now, and they're available to you.
Thank you so much, Dr. Chotani. Always a pleasure.
My pleasure. Thank you so much.